Hi, I'm Dr. Michael Rose. I'm one of the plastic and reconstructive surgeons at the Plastic Surgery Center here in New Jersey. Today I'm going to talk to you a little bit about one of the conditions that I treat called foot drop. So foot drop is when the foot is not able to flex backwards as you walk. So normally your foot comes up and you take another step, but if you don't have that ability to pull up your foot because it has dropped, you have to take a bigger step, and it's a big slapping gait known as a steppage gait. So the symptoms of foot drop are basically that the foot drags behind them, it gets caught, they trip over their own toes. It can be a mild foot drop where the foot just isn't quite strong enough to make the dorsiflexion, as it is, to clear the floor. But sometimes it can be very profound where the foot can't be lifted up at all and the patient's very, very aware of it. So in a mild case, the patient might just notice that they're tripping a little more over their feet and think it's a little weird. But in a severe case, the patient is very aware that their foot does not move upwards and they have to walk very differently to make up for that. When people first realize they have a foot drop, they're usually offered physical therapy to try to strengthen whatever is left. The cause is attempted to be figured out, and in the meanwhile, we usually give them what's known as an AFO, or an ankle foot orthotic, and what that does is it's an insert that goes into their shoe and comes up the back of their calf and basically holds their foot in that position so that when they walk, it doesn't flop down and they don't trip over their toes. At the Institute for Advanced Reconstruction, we offer a number of procedures for people with foot drop, and what we offer basically depends on what the cause of the foot drop is. And the foot drop can be caused by a nerve problem. In that case, we will focus our energies on trying to repair the nerve or bring another nerve over that is working better than the one that's not working. That's one possibility. If, however, the cause is because, let's say, the muscle isn't working for some reason or another, or the nerve is permanently damaged, we can do what's known as a tendon transfer, where we bring a working muscle and tendon over from another part of the leg and bring it over to the part of the foot and leg where it pulls the foot up so it can clear the floor. And that's known as a tendon transfer, and there's a number of different variations on that based upon what the condition and the situations might be. Recovery after foot drop surgery really depends on what surgery we ended up doing. If we did just a nerve release type of a surgery or even a nerve reconstruction, you might be back on your feet and weight bearing right away. Maybe a week at the most, you'll be off your feet, and then we'll slowly get you back to weight bearing and physical therapy to try to get things moving again while we wait for the nerve to regain its function. If, however, you have a tendon transfer, you're immobilized and off your foot with no weight bearing for several weeks, usually 3 to 4, and then you slowly reintroduce weight bearing back into the situation as you do your physical therapy. The benefits of foot drop surgery are that the patient feels that they can resume normal activities again. They don't fear that they're going to trip over their feet. In many cases, they can resume more vigorous activities and even sports. And it gets them out of this AFO that I spoke about, the ankle foot orthotic, which helps them hold their foot up when they're walking before they have surgery, or if surgery is not able to be done. So people really want to get out of that AFO as soon as possible so that they can resume a more normal lifestyle.